proceed with this. Okay. So hello everyone. My name is Dr. Ankita Hase. For those who don't know me, I'm a neurophysiotherapist from Nashik. And today I'm going to take a class on electrodiagnostic testing. It basically I started this classes because I thought it is very important for physios to know electrodiagnostic testing. इसीलिए EMG is the basics. So we'll start with EMG. Later on, I will also learn about NCS and evoked potential, which is very neuro-based, but it's very important for ortho and pediatric too. So I'll be very glad if you all join then also. So let's get started. सो सबसे पहले इलेक्ट्रोडायग्नोस्टिक टेस्टिंग एक नर्व एंड मसल कम्युनिकेशन है. सो एवरी मूवमेंट यू ट्रेन, whether it is balance, whether it is asking patient to grasp something or walking, everything starts with an electrical signal. So this signal is sent from the brain to the spinal cord to the peripheral nerves. So electrodiagnostic test basically एक microphone के जैसा काम करते हैं, which helps us know where the issue is, whether it is in the brain, it is in the spine or peripheral nerve pathways or at the muscle. So this tells us, one second. So before starting electrodiagnostic testing, I want you all to have a basic knowledge of what action potential is. So अगर doubt है, अगर लग रहा है कि मैं गलत हूँ, तो please correct me. It's a friendly zone. Nobody is anyone senior here. So action potential basically means that uh, when the muscle is at rest, membrane is at rest, it is at minus 70 millivolt. This, if you can see, 1 minute. हाँ, तो ये -70 मिलीवोल्ट है ना, इस पे अपना मसल हमेशा रेस्टिंग पे रहता है एंड देर इज ऑलवेज अ नेगेटिव चार्ज ऑन आवर मेम्ब्रेन. ओके, दैट इज अ स्टेट वेयर वी कैन प्रोवाइड अ स्टिमुलस, and that stimulus, if it is of a very good intensity, then it reaches the threshold. But अगर वो छोटे weak stimulus होंगे तो वो reach नहीं करता and it gives failed initiation. So any action to happen in our body, there is an action potential happening in our cell membrane. तो stimulus can be chemical, mechanical या फिर electrical. So इन तीनों में से कोई भी stimulus, if it is at a stronger intensity, if it crosses the threshold which is -55 millivolt, then it gives a good action potential. So threshold के बाद ऊपर जब ये जाता है ग्राफ, depolarization होता है. Depolarization means in our cell membrane, ऊपर का जो membrane का outer part होता है, that is negatively charged. सो उसको पॉजिटिव करने के लिए बहुत सारा सोडियम आयंस का इनफ्लक्स होता है सोडियम चैनल्स की वजह से. इनफ्लक्स के बाद दिस sodium goes in and then the membrane starts becoming positive. So this graph goes up and plus 40 millivolt तक it goes. तो तब एक एक्शन होता है and then the muscle starts relaxing. तो रिलैक्स कैसे होता है? The repolarization से. So the calcium goes out of the cell. So positive बहुत सारा जब बाहर निकलने लगता है, the calcium channels take time to close. That's why hyperpolarization होता है. And then, one second. And then it goes back to the resting state. Resting state में जाने के बाद ही you can provide another stimulus to the cell membrane. इतने फेज में there you cannot give any stimulus again and उसका कुछ action भी नहीं होगा. So for a muscle to react to the stimulus, it has to be in a resting state. So this is how an action potential works. So if you know the basics, EMG is very easy. So physios के लिए why is it important? Because it helps us understand the source of the weakness, whether it is nerve, muscle or neuromuscular junction. So एक basic पता चल जाता है and it helps us differentiate weakness from poor activation या फिर nerve supply, nerve is not conducting properly or the muscle has the issue. So this differentiation of weakness is what electrodiagnostic tests tell us. And it also helps us find if we are overloading the muscle or not. जब nerve denervate होती है, the muscle will automatically be weak and communication खराब हो जाता है in muscle and nerve. So when we know that it is a nerve issue, we will not overload. We will ask the patient to relax, fatigue management, ये सब role आता है physio का. But for that to know, we should know where the issue is. That's why it is important for us to know electrodiagnostic testing. It also helps us improve our clinical reasoning. Physios, जब भी अपने पास patient आता है, we blindly just start giving them exercises before assessing. That is clinically not right. We should have a protocol. We should have a proper systematic criteria for assessing the patient. हम MMT check करते हैं, sensory examination करते हैं, but that tells us what is the issue. Muscle में strength में issue है या फिर conduction में issue है. But for example, you see an MRI में there is no disc bulge and still patient is complaining of tingling. So what is the next step you will do? Uh, One second. So the next step you do is you do a nerve conduction study or EMG. It helps us find the issue is in the muscle or the nerve. Okay. One second. Um, okay. So let's proceed further. 1 minute. Okay, so EDT, what does EDT helps us find? It helps us find the difference to determine if there is neural issue or muscular issue. Uh, and it helps us find if the issue is central or at the peripheral extremity, if it is axonal or demyelinating, if it is acute, chronic, or recovering lesion. So, if we know all this, if we get to know that the issue is at the nerve level or muscular level, our protocol changes, our way of treatment changes. That's why it is important for us to find where the problem is. So, एक second. Hmm. So there are different types of electrodiagnostic test. जिसमें से first we will cover is EMG and we'll also cover NCS and evoke potential in the coming sessions. So electromyography is a test which assesses electrical activity in the muscle at rest or during contractions. So let's get this started. EMG is a study and recording of electrical activity at the muscle. So basically, if am I visible to you all or only the screen is visible?
You are both visible.
Both, na? Okay. So can you see this red thing? So for example, this is a muscle. So when in EMG, we have to test the muscle activity at rest when there is no movement. Second, when there is insertional activity, the needle is inserted, then we will see some graphs. After the needle is inserted and placed, we relax the muscle and we ask the patient to contract. So voluntary contraction में also we will record. This is how we check electromyography में muscle activity. So this insertion is at the muscle only, but sometimes it can go to neuromuscular junctions that will cause some electrical signals, but these are all normal signals. एक minute. These are all normal signals. We will see how it goes ahead. एक minute. हाँ, so to know the basics of EMG, अभी हमने action potential जैसे पढ़ा. This graph is also basically the motor unit action potential. So one fiber, when it is stimulated, it gives this graph, which is MUAP, motor unit action potential. So it has, so this starting point is the stimulus. That's when the muscle is stimulated mechanically in EMG. The latency is the time for it to take for the recording electrode to record. That is latency. Then इस ग्राफ में क्या होता है, नीचे वाला पार्ट इज पॉजिटिव. सो इट, जैसे मैंने बोला, सोडियम चैनल्स ओपन होता है, सोडियम आयंस इनफ्लक्स होता है. देन देर इज positive depolarization that leads to the graph to go down, and then there is repolarization which leads the graph to go up, that is negative, and then the muscle comes into relaxation by hyperpolarization. So it's basically the same graph, but it is triphasic waveform में, same action potential. Okay, so so first we'll start normal EMG at insertional activity. So this is a muscle, we insert the muscle. During insertion, there will be a graph like this. Okay, and when you insert and remove your hand and like leave the needle, then it should come back to static again. If it is not coming back to static, then there is an issue. So you should always know the muscle is silent when it is not reacting. Insertion mein there will be some graphs, and then when you relax, there should again be static or no silent movement in the muscle. So when you insert the needle, there is a crisp static sound which comes in the recording electrode. So the machine makes a sound. So that is like a crisp static sound. Second, EMG at rest is silent. So when the muscle is not moving, the EMG graph will come very silent, very static. So you should know that is normal during rest. Now, what is end plate at rest? Do you know what end plate is? Anyone? Can anyone tell me end plate का मतलब क्या है? Am I audible?
Yes.
हाँ. So end plate is nothing but neuromuscular junction. उसको end plate बोलते हैं because the junction ends at the muscle. So uh, if, for example, I'm inserting a needle and it inserts into a neuromuscular junction, तो जंक्शन में देर इज ऑलवेज अ रिलीज ऑफ एसिटाइलकोलिन. एसिटाइलकोलिन हमेशा इट keeps entering the muscle normally also. So that's why there is this end plate noise, this one. So noise is normal if it is at the neuromuscular junction. It makes a sound of rain. There is continuous rain में कैसे बारिश में कैसे आवाज आता है वैसा noise keeps coming, that is normal at neuromuscular junction. And that is at rest. Okay, so I have put the needle and I have relaxed, तो वो noise आता रहेगा continuously. uh, Okay, next is at insertion. So when I'm inserting at neuromuscular junction, so insertion ke time pe there will be sharp spikes which will be visible with noise. So that is also normal. So हम कभी भी end plate पे check नहीं करते muscle को. Whenever we see this kind of noise and spikes, we just remove the needle and place it somewhere else, little far from the neuromuscular junction. So then we get a again silent graph because with no activity there should be silence. So that tells us कि हमने neuromuscular junction में लगाया, and these are normal noises and spikes which are visible at neuromuscular junction. That is called end plate noise and spike. Now we have inserted the electrode, needle electrode. So you tell the patient to do a very small flicker. Like we'll take example of just holding something. Okay. So we'll just ask the patient to tap to the uh, pen I'm holding. Okay. So when you tap, you see that there is a normal MUAP, which is the same like action potential. So the duration are very, 1 second. Yes, duration are of 2 to 10 milliseconds. Frequency is of 10 to 5 to 10 hertz के बीच में frequency रहता है, and it is very regular and rhythmic. Okay, when you do small flickerings. Similarly, when you ask the patient to contract with more force, now I'll ask the patient to hold with maximum strength. So इसमें क्या होगा? There will be interference because a lot of other muscles are also acting for you to hold a pen, and these needles are very sensitive to movement. So बाकी के जो muscle activity है वो भी needle catches. So there is a lot of interference which is seen in the graph, which is visible like this. So the first graph is gentle contraction. This is an abdominal graph, but I'll give an example of holding this. So I'll ask the patient to hold with gentle strength. So you will see this first three graphs. तो ऐसे graphs दिखेंगे. There will be interferences. It will not be a clear MUAP. When you ask the patient to put moderate strength, then you'll see a little thicker graph. And with maximum strength, you will see more thicker graph. So these are normal. Whenever it's very common in sorry, it is very common in sports patients, sports injury patient, when therapists check their hamstring strength or something. So they ask the patient to do standing mein needle electrode is placed in the hamstring, and the therapist asks the player to do an hamstring curl very lightly. So when he does lightly, this is how the graph is shown at hamstring. When the therapist puts a little resistance, then this is how the graph is seen. And with maximum resistance, this is how the graph is seen. So these are normal movements. Interferences are normal. Okay. So far, this is what a normal EMG looks like. Do you have any issue or कोई क्वेश्चन होगा तो प्लीज पूछ लेना. समझ में आया?
Yes.
Yes,
Okay.
ma'am.
Yes, ma'am.
Okay, so this is normal EMG. EMG tests. EMG हम लोग कब टेस्ट करते हैं? रेस्ट में, नीडल इंसर्शन में और वॉलेंटरी कॉन्ट्रैक्शन में. तो याद रखना. At rest, it is silent. At insertion, there will be insertional activity and contraction. And this is at neuromuscular junction. You should remember this. एंड मिनिमम कॉन्ट्रैक्शन में एक नॉर्मल MUAP आता है. MUAP इज नथिंग बट मोटर यूनिट एक्शन पोटेंशियल, मतलब एक फाइबर का मूवमेंट हो रहा है. ओके, दिस इज वेरी रेगुलर एंड रिदमिक इन नॉर्मल EMG. एंड maximum contraction में then you will see graphs like this which will be very interferential. Okay, so normal EMG समझ गया, basic.
Yes, ma'am.
Yes.
कुछ क्वेश्चन है? किसी को कुछ डाउट? So far all good? Okay, so let's move ahead with abnormal EMG. 1 minute. हाँ, तो abnormal EMG two types के होते हैं. First is when there is a myopathic lesion, and second when there is a neuropathic lesion. Okay, so myopathic lesion में क्या होता है? Nerve supply is intact, the nerve is very good, but the muscle fibers are diseased and damaged. So mostly these are seen in DMD. Shreyas, you are a pediatric physio, right?
Yes.
Yes. So you must have seen DMD patients. DMD is a disorder basically which has all the nerves intact, but there is a genetic condition which leads to less muscle
Muscular
fiber.
weakness.
Yes. और
Yes.
muscles कम बनते हैं. So there is abnormality in the muscle, not the nerve.
Yes.
Similarly, there are many myopathic cases जिसमें metabolic issues की वजह से muscle gets degenerated. Muscle को उतना sodium potassium channels don't work properly, so the muscle becomes atrophied. So in these cases, we know that this is a myopathic lesion, जिसमें nerve intact है, but there is a muscle issue. So yes, so iska pathophysiology is one, like genetic issues like DMDs. Second, sodium and chloride channel ions, ion channels में जब imbalances होता है, the muscle does not get good nutrition and they can get atrophied. तो इसीलिए there are myotonic discharges which are seen in this abnormalities such as this. So rest में positive discharge and negative discharge दिखता है in myotonic condition. Okay. So as we discussed DMD में when you insert a needle in a DMD patient's hand or leg, any muscle, you will see rest way there is positive discharge. It can be either positive or either negative. पॉजिटिव कब आता है? जब सोडियम का इन्फ्लक्स बहुत ज्यादा होता है, देन हाउ इट शुड बी, या फिर क्लोराइड का जब when chloride also comes into the cell, so that leads to negative discharge. So too much negative uh, uh, ions coming in the cell will lead to negative discharge, and too much positive in the cell will lead to positive discharge. So we know that the muscle is not resting, the muscle is not relaxed. So ये एक disorder, एक deformity है in myotonic lesions. Positive discharges are seen in at rest. Second, जो MUAP हमने देखा था in normal muscle fiber, that is very small in myopathic lesion because muscle इतना active नहीं है, fibers इतना active नहीं है. That's why they don't contract very nicely, and it is very visibly seen that myopathic lesion में छोटा MUP या irregular MUPs आते like this. Okay, so we'll immediately know that it is not rhythmic and there is a deformity in muscle. Second, sorry, maximum, abhi, at rest, we saw that there are this discharges which are seen. Insertion maybe there will be no graph. Normal muscle में insertion में we see this positive negative discharge दिखता है and then again it becomes silent. But myopathic lesion में insertion में भी there will be silence. Minimum contraction में you will see this smaller MUPs, and maximum contraction में छोटे छोटे interference दिखेंगे. It will not be very proper dark interference like we saw in the normal muscle contraction वाला EMG, but these will be very small spikes which will be visible in myopathic lesion. So understood myopathic lesion so far?
I have a doubt.
Yes, yes. Yes,
I
Shreyas.
have a doubt.
Yes, yes.
MUP silent of myopathy and
हाँ.
the end plate MUP are approximately similar. They are very difficult to find difference between the resting myopathic MUP and
Yes.
the end plate MUP. So
Yes.
how can we do that?
Are you talking about myopathic contraction में जो ग्राफ आता है वो, और this minimum contraction में?
During insertion,
हाँ.
the MUP during insertion of a myopathic, the graph during the insertion of the
Yes.
myopathic when it is negative, it is
Yes.
as similar as the end plate noise.
No. 1 minute. I'll show you. This end plate one, no, will be like these are very small spikes, very small. So this is how the muscle is during rest. And this will be very small graphs. So you know it is end plate and it will be continuous. इंसर्शन के टाइम पे जब हम नीडल इंसर्ट करते हैं एंड जब छोड़ देते हैं ना, तो देन इट अगेन स्टार्ट्स बिकमिंग साइलेंट लाइक दिस, सो दैट वी नो दैट इट इज नॉर्मल. पर जब इंसर्ट करने के बाद भी देर आर सम स्पाइक्स एंड नॉइजेस सीन, दैट मीन्स हमने न्यूरोमस्कुलर जंक्शन में डाला एंड देन वी रिप्लेस द नीडल समवेयर एल्स.
Okay,
हाँ
because I had a case where during the procedure we
yes
were getting the at some places we were getting the insertion myopathic similar as the antlet. So
अच्छा
I was confused about that.
ओके ओके बट मायोपैथिक लीजन में ना इंसर्शन पे हाँ इट शोज समटाइम्स लाइक स्पाइक्स बट इंसर्शन करने के बाद व्हेन वी लीव नो इट बिकम साइलेंट सो देन वी नो
Okay,
दैट मायोपैथिक में ना इंसर्ट करने के बाद थोड़ा टाइम ग्राफ आएगा बट देन इट बिकम साइलेंट व्हेन वी लीव द नीडल बट एंड प्लेट पे आएगा तो देर विल बी ऑलवेज एसिटाइल कोलिन रिलीज तो वो कंडक्ट होता ही रहेगा सो दैट्स हाउ वी नो कि
okay,
वो इंसर्शन पे है इंसर्शन पे वो बंद हो जाता है एंड प्लेट में देर विल ऑलवेज बी
okay,
सम कंडक्शन दैट्स हाउ वी डिफरेंशिएट ओके ओके
okay. Thank you, ma'am.
यस यस ओके ओके विल मूव फॉरवर्ड विद न्यूरोपैथिक लीजन फटाफट टाइम नहीं है न्यूरोपैथिक लीजन में मसल इज इंटैक्ट बट देर इज इशू इन द नर्व सो पेरिफेरल नर्व पैथोलॉजी हो सकता है जिसमें एंटीरियर हॉर्न सेल इशू होगा इधर नर्व रूट इशू होगा और पेरिफेरल नर्व में इशू होगा सो what happens is when a nerve is not I'll show one graph. So these are one myofibers, muscle fibers. ठीक है? You can see this neuromuscular junctions है fibers पे. For example, अभी ये black mark दिख रहा है. I have cut the nerve, like the nerve is cut, for example. So what happens is बाजू के जो nerve endings है ना, that will also start supplying to that muscle fiber which is cut. So that is the we can say one very special thing about nerves is it supplies to the muscle which are denervated. So very clear ग्राफ में चेंजेस कैसे आता है मसल एंड न्यूरो में इज दैट नर्व के न्यूरोपैथिक लीजन के जितने भी ग्राफ होंगे दैट विल बी जायंट दैट विल बी वेरी बिग एग्जैजरेटेड बिकॉज ऑल द अदर नर्व्स आर ऑल्सो इनर्वेटेड इनटू द दिस मसल फाइबर्स जो कट हो गया है तो री इनर्वेशन हो जाता है दैट लीड्स टू बिग बिग ग्राफ्स सो दैट्स हाउ वी नो इट इज अ नर्व इशू और अ मसल इशू so, yes. So we'll at rest, isme bhi there will be always some kind of contraction. We'll see how we differentiate it with end plate also. So rest ke time pe, we insert the needle and then we leave. After that, we see fibrillation. Fibrillation are rhythmic, triphasic, positive, negative rhythms. It means एक मायोफाइब्रिल एक मसल फाइबर जो कट हो गया है ना वहां पे डिनर्वेशन हो गया है so some nerve is continuously supplying acetylcholine. That's why we see fibrillation in this cases. So it is very common in acute or chronic denervation. जहाँ पे नर्व कट गया है रेडिकुलोपैथी है पेरिफेरल न्यूरोपैथी एंड मोटर न्यूरॉन डिजीज में फिब्रिलेशन इज वेरी commonly seen at rest. Second is positive sharp waves. These are like sawtooth uh, and these are only seen in very chronic denervation. So if you see a sawtooth like deformity, you should know that ये बहुत पहले से nerve supply मिल नहीं रहा है. That's why other nerves are supplying, and it gives this appearance because the muscle is taking very long to relax. Muscle is getting contracted, but time ले रहा है to relax. That's why sawtooth like appearance दिखता है in this kind of cases at rest. Third is fasciculation. Fasciculation is mainly seen in cases of ALS जहाँ पे पूरा like समझो रेडियल नर्व ही कट गया है तो द रेडियल नर्व जो भी मसल को सप्लाई करता है वहां पे बाकी के नर्व्स स्टार्टेड सप्लाइंग अल्नार नर्व का कुछ ब्रांचेस मीडियल नर्व का कुछ ब्रांचेस सो व्हाट हैपेंस इज देयर इज अ लॉट ऑफ इंटरफेरेंस सो दैट लीड्स टू fasciculation at rest. So you understand that इसमें बहुत like there is a major nerve which is damaged. That's why other nerves are also supplying. That's why there are so many interferences seen in fasciculation. And the next one is complex repetitive discharge. ये कॉम्प्लेक्स वेव्स होते हैं पॉजिटिव नेगेटिव थोड़े से यूनिफॉर्म होते हैं बट दिस इज हाउ आई गॉट द ग्राफ इट इज नॉट वेरी रेगुलर बट दे आर सेड टू बी रेगुलर. This sounds like machine gun and it is very commonly seen in old stable lesions, और जिसमें ये complex repetitive discharge दिखता है. These cases are very difficult to be treated with exercises. So mostly this is a red flag to be seen in any patient. अगर complex repetitive discharge दिख रहा है मतलब rehab से भी it is very difficult for a patient to treat. It's very commonly seen in spinal cord injury cases जिसमें complete injury है but complete or incomplete injuries, but there are some muscles who are very atrophied because nerve supply ही नहीं है. So there we see complex repetitive discharges. On minimum contraction, you see very large MUAPs like this. Okay, so it is extremely large than normal MUAP. So we know that it is neuropathic because बाकी के nerves supply कर रहे. This amplitude basically means कि बहुत सारे nerves है, बहुत सारे nerves साथ में एक muscle को contract कर रहे. That means the graph. That's why the graph comes very big. Sometimes there are also this irregular graph seen, but this will be also very big positive, negative, sharp waves दिखेंगे इसमें भी. Second, on contraction. Abhi we'll ask the patient to contract the muscle. So how we saw the interferences in normal MUAP, neuropathic lesion में there will be interrupted MUAP, interrupted graphs. So patient is trying to contract with full force, but वो बीच में interrupt हो रहे हैं, and it is very regular. Okay, that means some particular muscle are not working because उसमें nerve denervated हो गए हैं, इसीलिए there will be बीच बीच में this interference is seen in this kind of cases. So neuropathic lesion में कुछ confusion है? Any doubts? All clear? किसी को पूछना
Yes, ma'am.
है? ठीक है. So let's summarize in the end. One second. We'll have to finish quick. Okay. So just remember, rest में normal graph is electro signal silent होता है. There will be no signals. In myopathic lesion, there will be small positive and negative discharges. In neuropathic lesion, there will be uh, a lot of disturbances like fibrillation, continuous discharges, positive sharp waves. So we'll be able to differentiate neurogenic cases hai ya myopathic cases hai. On minimum contraction, normal will give a normal MUAP. Myopathic lesion will give small MUAPs and neuropathic lesions will give a large MUAPs. In maximum contraction, normal will give good interference, thick interferences.
as it is a very long process. Every time we are asked when what will be the time of recovery or what will be the outcome or how good the patient will be to the recovery. So it is very important to communicate with the easily we can communicate with the parents that this will be the procedure. It may take this much time or it covered.
Yes, yes, yes.
Verification is very important to give to the.
Yes, and also if we have EMG testing in our workplaces, EMG or NCV, it also gives us a way to assess patient before and after the treatment. So we can show the patient with numbers and with graphs that this is the improvement we are seeing after rehab. So it is very like क्या बोलते हैं वो appropriate criteria है how we should treat patients. We should always assess first and then we should show them the numbers. फिर एक set of time के बाद एक goal set करने के बाद when we give them exercises, the goals are met. Also when we do the test again, the graph improves, the numbers are good. So we can show this to the patient, say this is the improvement, and that gives hope in them. And agar exercise se bhi the graphs, the numbers are showing less, there is no improvement. So we can also tell them that even though we worked with the exercises, there are no improvement in the graph. So this is how it will be. Then you have to, like Shreya said, कि आगे क्या होगा, वो बताने के लिए we have a graph, we have some numbers. We cannot show them MMT and sensory reflex दिखा के कि पहले reflex अच्छा था अब कम हो गया. But this really helps as a physio. Anyone else, if you want to put any input?
Ankita was asking for me. Hi, I'm Jabastin.
Hi, Sebastian. Hi.
I think EMG is the base for EMG feedback as well. Once we start treating patients with the help of EMG feedback, we need to know our basics with EMG. And like Shreyas said, very comprehensively covered all the points. He was talking about communicating with the patient regarding what is the extent of injury that has happened. It gives physios a leverage, a huge confidence in how they can um, proceed with their intervention. So that's a added advantage, and it's always a huge asset to know what EMG, uh, how EMG functions in a person. So that's something that I wanted to add. Thank you.
Yes, yes. Thank you, Sebastian. Um, Anyone else, if you want to put any inputs in EMG? I had one more question. We plan a rehab protocol for patient. So is it not important for us to have the, like Sebastian said, it is important for us to know the basics at least. But will it not help, or will it help in planning a protocol or goal setting for us? Like as physios, we should know how much load we should put on the patient, how well their endurance is, and when should we progress with another like protocol, or when should we progress with more strengthening exercises or something like that. So it does help us, um, uh, what do you say? It helps a lot in physios. So I just wanted to ask if it is, what is your say in how important it is for physios? Any one of you? कुछ भी इनपुट देना होगा प्रोटोकॉल के बारे में तो प्लीज शेयर. Shruti?
I think just like Dr. Shreyas has mentioned that it's helpful for the free, like to just check out whether it's a muscular or it's a nerve related. So we eventually get an idea after an EMG or electrodiagnosis is done that whether how good is the muscle or how weak is the muscle, and eventually we can plan for the protocol, and then after we do the rehab, and then we can take an again EMG and check it out. So how better the rehab has worked on it, and eventually we can give a good feedback about the what rehabilitation can be done for the patients. So it really helps after the rehab too.
Yes, yes, definitely. Arohi or Tanmay, do you want to add something? So Arohi and Tanmay both work with me. So we do NCS in a lot of patients who have back pain or radiculopathies. So they are also learning EMG NCV. So Arohi, Tanmay, do you want to add
Yes, ma'am.
anything?
Yes, ma'am. So in the neuro rehabilitation करतोय आपण. So
Oh.
त्याच्यामध्ये EMG will help us
Could you please
to
speak in
identify.
Hindi or English?
Okay.
Not everyone knows. Huh.
Yes.
Yes, yes.
So, ma'am, in neuro rehabilitation, EMG will assess like abnormal muscle activation, timing, and their recruitment patterns. So, based on EMG findings, we can plan a targeted rehabilitation, which will focus on like facilitation of weak muscles or inhibition of spastic muscle and the muscle re-education and task-specific functional training, etc.
Yes, yes.
So, it will help us to
Tanmay, you
make
want
a
to add anything? Yes. Thank you, Arohi.
Yes, ma'am, we can give patient the outcomes provided and it become more effective and evidence-based care can we give as a physio
Okay, okay.
on the basis of EMG.
Okay. Uh, yes, Sebastian.
I just wanted to add a quick note that
Yes,
I
please
think
go.
as physios, we use SMART goals to set goals for patient. And the first thing that in SMART goals, it says being specific and having EMG as our tool to set the goals or for goal setting.
Yes,
It's the first criteria that we can use to goal setting. It becomes very specific, time bound. We can be very confident again. So I was thinking that in SMART goals, it demands us to use EMG as one of the tools to set goals for.
yes, 100%. Yes, you're so right. I was going to come to smart goals only. Yeah, so it was very nice. The session was very nice. Yes, Shreyas, bolna. Yes, yes.
Not only as a clinical physiotherapist, but when during our PGs, we used to be in a clinical setup where research oriented goals were set up.
Yes.
And we were always asked to be specific with your treatment. So, and as we had in my UG also, we had the training by you only and the seniors,
Yes.
Shubham sir and all, that we had training for EMG and NCV. We could read.
Yes.
We have also performed that.
Yes.
NCV, EMG, NCV, we have performed under our seniors. So it gave me a leverage to question back my staff, also answer their questions and give them as Sebastian said that a numerical outcome that this was the previous one and this is the post treatment protocol. So my protocol is going good, and I could take a stand for my treatment protocol always.
Yes, wonderful, Shreyas. Okay, so I was going to come to SMART goals. So, for those who don't know, SMART goals is a goal setting protocol for physios. It basically is a short form for specific, measurable, attainable, uh, recordable, and time bound. Is it recordable? I forgot.
It's reliable.
Reliable, sorry. Yeah. Reliable and time bound. So, EMG helps us to measure all this criterias and also set goal based on this uh, uh, what do you call it? The test. Um, 1 second. एक minute. सो स्मार्ट गोल से क्या होगा स्मार्ट गोल से इट विल help neuro patients we will as Arohi said it will help us facilitate the weak muscles in neuro protect what is damaged and prevent fatigue in such patients in motor issues it will help us strengthen the muscle it will help us decide how much dose of exercises, how many repetition of exercises to give in patients with myopathic lesions, and also improve endurance in them. When we see graphs of recovering the in neuropathic lesion, we know that we have to now train the patient specifically for task-oriented training and avoid overloading of those functions. In chronic denervation, when there is the nerve supply is cut for a long time, we then help patient to compensate. We help them to adapt to other, like we give them braces and we help them teach certain movements, but with trick movements, but that is also fine, but they should be able to do such movements and educate them to relevant. Okay. Yeah. And educate them कि अभी for example let's take an example, the radial nerve damage हो गया, they are able to hold the glass like this. Okay, but with compensation, with braces, we can teach them to adapt and hold the glass properly. So that EMG helps us find all this. So yeah, that's it. If anyone wants to add anything, then अगर कुछ नहीं है तो we'll then conclude the session. I'm sorry, this is my first time. Please be nice. Okay. ठीक है. So we'll conclude the session. Thank you all for joining. I'm very happy that you all joined. It was my first time, and I'll try to improve myself in the next session. We will take NCS next time. NCS and evoke potential. It's a little uh, big, so we will have big meeting that time. I will take at least 2 weeks for myself to prepare for it. So after 2 weeks, I'll keep you updated with the form and links and everything. Please do join and we'll learn about NCS too. Yes. Chalo, thank you all for coming.
Thank you so much.
Thank you.